at one point, Joe Biden was choosing to respond to the fact that Bernie's been putting a spotlight on Medicare for All, what it could have done for our country if it were already implemented. And he decided to talk about Italy.
You have a single payer system in Italy. It doesn't work there. It has nothing to do with Medicare for All. That would not solve the problem at all. We can take care of that right now by making sure that no one has to pay for treatment, period, because of the crisis. No one has to pay for whatever drugs are needed, period, because of the crisis. No one has to pay for hospitalization because of the crisis, period. That is a national emergency, and that's how it's handled. It is not working in Italy right now, and they have a single payer system.
So I think what Joe Biden said was nonsense for two different reasons. One, Bernie Sanders has never said that the only thing you need is a single payer healthcare system, and that's it, you're good if anything happens. But also, he kept stressing, like because this is a crisis, you shouldn't have to pay for the testing. Because this is a crisis, you shouldn't have to pay for the treatment. But thousands and thousands and thousands of people die every single year, as Bernie did point out multiple times, because they can't get health care that they need. But even people who have health insurance, they will die from cancer and heart disease and diabetes and a number of other chronic conditions, some of which they will not get the actual treatment that they need. Even if they hypothetically have some health insurance, they will not get what they need because we have this interlocking web of competing plans, some of which are better than others. And that was pointed out by Bernie as well. He kept trying to pretend that this is the crisis and the only crisis we face, whereas Bernie Sanders has always been cognizant of the number of crises that we've just sort of gotten used to. Certainly that politicians have gotten used to.
Well, so to your point about crises, he kept saying this is a national emergency. It's a crisis for all of us. But if you have late stage cancer, that's definitely a crisis. It just happens to be a personal crisis, but it happens on a mass scale as well throughout the country. People get that, they get hundreds of other kinds of life-threatening illnesses. And basically what Biden is saying by implication is, well, the coronavirus is important because it's got a lot of media headlines. But if you have a life-threatening crisis, I don't really care that much about it. And you say, well, come on, are you being fair to Joe Biden? But he's telling you that if it's a national crisis where your life is in danger, he does care a lot about it, and he thinks the government should pay for it. But if it's not a national crisis, it's just your personal crisis, you're about to die, well, that's not his problem, and it shouldn't be the government's problem. You should try to afford private insurance if you can. So that's just the reality of his plan. In terms of Italy, they're making it seem like because they have single payer, they have had this huge outbreak. Well, that's not true. China had a huge outbreak, Iran had a huge outbreak, and partly those folks in Norway, et cetera. Why? Partly because they already have test kits, because their system is better than ours. We might have an enormous outbreak in America, but we don't know because we haven't tested anyone. And I see right-wingers totally falling into the trap of Trump, or maybe willingly walking into it online today. They're like, oh, we don't have that many cases. No, we haven't tested anybody. We've been like, last I checked, we tested like 10,000 people in a country of 330 million people. The reason Norway seems to have a lot of cases is because they were so good at testing early, so they know most of the cases. Whereas we're stabbing in the dark for answers here. And soon if the millions of test kits finally come in, next week we might be hit with a giant wave, not because they're new, but because we found out about them so late.
And we have over 3,000 already that we do know from our limited testing.
Yeah, and it's really insane, the whole testing situation, in part that we were offered from the WHO these test kits, and then Trump says, no, it's okay, we don't want them. And now we see that other countries are able to contain better because they know the problem they're facing. And as you pointed out, we're stabbing in the dark. We don't have this information. And unfortunately, it continues to fuel and feed this elitist mentality of it's because we're better. That's why we have fewer cases. No, it's because we've chosen to be ignorant, unfortunately.
And one other thing that I wish that Bernie had said, maybe to some extent he said it, but where Biden is like, because it's a crisis, we need to make this change for your testing, this change for your coverage, all of that. We're gonna cover you this one thing. If we had Medicare for all, we'd already have that. We would not have had to go into immediate lockdown mode and figure something out as people are panicking. the system would have just already been better. Sure, we would have had to ship around a bunch of testing kits, but you'd already know that as with everything else, if you need to get tested for it, you can get tested for it. We would smoothly transition into this pandemic. And the issue is that even if we had, let's say Biden was president now, and he did what he said he was gonna do, we've got you covered for coronavirus, COVID-19. Okay, well, what about COVID-20? What about COVID-21? What if Ebola springs up again? Then we need to always be just, God, DC, please do something now. Again, it's another emergency that we're not ready for. You need to then spin up government to deal with it, rather than, if we had Bernie, we would still be ready for it. COVID-20, COVID-21, we'd be ready.
Yeah. And two more quick points. One is, they say, oh, Italy is rationing healthcare. I don't know that that's anywhere near true. They're trying the best they can. Their hospitals are overrun, as a lot of hospitals are overrun throughout the rest of the world, because they already know who has coronavirus, whereas we don't. But to me, it's a hilarious talking point, because private insurance in this country rations healthcare all the time. Even if you have insurance, they often deny you coverage. I mean, you want to talk about a death panel, and they'll say, oh, no, you got a great cancer doctor? Out of network, we're gonna have to ration coverage. Let alone the fact that they don't have the test kits. And hey, libertarians, what happened? I thought that you didn't need the government for anything. Now all of a sudden, everybody's a socialist. Government, help us! Government, help us! Why didn't your private industry already have millions of test kits ready? Because they didn't know the disease was coming, to be fair to them. That means the market cannot preemptively solve every answer. The correct answer is a combination of the market and the government to protect people. Thanks for watching The Young Turks, really appreciate it. Another way to show support is through YouTube memberships. You'll get to interact with us more. There's live chat emojis, badges. You've got emojis of me, Anna, John, JR, so those are super fun. But you also get playback of our exclusive member-only shows and specials right after they air. So all of that, all you gotta do is click that join button right underneath the video. Thank you.